In this video, we'll be discussing Ipamorelin with CJC 1295. One of the newest and most popular peptides in the growth factor releasing family, it's extremely well tolerated by patients and considered one of the safest GHRPs on the market today. Having shown tremendous results with few, if any, side effects for most people who take them, we're going to discuss the benefits, mechanisms of action, as well as how growth hormone therapy benefits patients and why peptides may be a better option for men and women looking to optimize their health through peptide therapy. What is Ipamorelin CJC 1295, you ask? Ipamorelin with CJC 1295 is a growth hormone releasing peptide that works on two different families of receptors of the pituitary gland to increase growth hormone levels in humans. They work together synergistically to produce excellent results and increase growth hormone pulsation superior to other growth hormone releasing hormones, or individually on their own. CJC 1295 is a synthetic growth hormone releasing hormone analog that consists of 30 different amino acids. It's shown to be very effective with regards to the increase of natural growth hormone secretion as well as IGF-1 without the negative side effects regarding the pulsing of growth hormone secretion. It mimics the hormones that stimulate growth hormone production in humans and doesn't affect the downregulation of the natural process. Often CJC 1295 is combined with Ipamorelin because of its increased specificity as a growth hormone releasing hormone. CJC 1295 generates similar boosts of growth hormone secretions but doesn't have the same stimulation of appetite and increase of cortisol, prolactin, acetylcholine, and aldosterone typically seen in the other peptides within the same class. CJC 1295 as a peptide is very well tolerated and has very few potential side effects, especially combined with Ipamorelin. Ipamorelin is a pentapeptide, a hormone made up of 5 amino acids, which imitates the process responsible for natural growth hormone release found in humans. Ipamorelin is called a growth hormone releasing peptide and will bind to ghrelin receptors acting as an analog, thus inducing the release of growth hormone. Ghrelin is a hormone that stimulates the pituitary to release growth hormone, and Ipamorelin mimics this process and increases the number of growth hormone releasing cells, or somatotrophs, in each wave of growth hormone production by suppressing somatostatin, a hormone that will suppress GH production. It will induce GH release and boost the number of somatotrophs, which are the cells responsible for growth hormone release, and a growth hormone pulse by suppressing the somatostatins. Ipamorelin stimulates the pituitary gland, thus produces a greater amount of growth hormone release in humans. Unlike taking HGH injections directly, which are very expensive and come with a greater risk, Ipamorelin lets the body produce growth hormone through the naturally occurring pathways in the body. What happens to growth hormone levels with age? By the age of 30, most humans' levels of growth hormone will be only about 20% from what their peak levels were during their childhood. And past the age of 30, they will continue to see declines in the human growth hormone levels at a rate of nearly 12 to 15% per decade, and in many cases the decline is greater depending on several factors such as genetics, lifestyle choices, stress, etc. What are the benefits of growth hormone therapy? First, growth hormone therapy gets rid of excess body fat, especially in the abdominal area. Abdominal fat reduction is one of the biggest effects of HGH replacement in most patients. It also will increase lean muscle mass and strength, especially when combined with just even moderate exercise, and improves the body's ability to repair and recover from injury and post-workout recovery. Ipamorelin and other peptides that release growth hormones will also help improve skin elasticity and reduce wrinkles and other effects of skin aging. It can help repair some internal organs which may have been atrophied with age. It'll increase your bone density and help strengthen the immune system. Ipamorelin also slows down and may even reverse cognitive decline and stimulate the production of bone marrow cells, which can help increase the production of healthy red blood cells. Ipamorelin and other peptides can also reduce the probability that one will have significant physical declines with age and become frail. It can also slow down the progression of cardiovascular disease and possibly reduce the risks associated with cardiovascular disease. Patients on Ipamorelin will also see increases in their sex drive and libido as well as performance, and there's an improvement in insulin sensitivity, and it will help reduce triglycerides. So why choose peptides over growth hormone therapy? First, growth hormones are prohibitively expensive for most patients and can cost well over $1,000 a month on the low end. You'll also see no decrease in natural growth hormone production from downregulation when you take peptides like Ipamorelin as opposed to growth hormones. And FDA, DEA, and restriction guidelines from state medical boards are significantly reduced with non-controlled substances like Sermorelin, Ipamorelin, and other peptides, which is not the case with human growth hormone, which is heavily regulated and restricted. Also, secretagogue peptides like Ipamorelin with CJC 1295 and Sermorelin have a significant decrease in risks and side effects as compared to growth hormone. They are readily available and well tolerated with few, if any, side effects. When should you take Ipamorelin with CJC 1295? Elevated insulin levels will act as inhibitors for growth hormone secretion, so it's advised to take the Ipamorelin with CJC 1295 at night on an empty stomach. This serves two purposes. One is that it will maximize the body's natural ability to produce growth hormone when blood insulin levels are low. And secondly, it will mimic the body's natural release of growth hormone, which occurs at night during sleep. Injections can be taken subcutaneously. Your dose will depend on a few factors, but typically it will be a 100 to 300 microgram dose daily at night, injected with an insulin needle. The most common side effects can be flushing of the skin, which resolve itself on its own and is seen more frequently at higher doses. As long as proper sterilization techniques are used for the injection, which includes swabbing the skin with an alcohol pad, Ipamorelin with CJC 1295 is extremely well tolerated in patients. What are the costs of Ipamorelin with CJC 1295, and how do I get started on therapy? Two common questions. First, treatments can range anywhere from $300 per month and upwards of $1,000 depending on your dose and frequency. It is still considerably less expensive than growth hormone and has way fewer risks. Prices with peptides may frequently change as the formulas that are being developed are continuously improving. Ipamorelin with CJC 1295 can only be prescribed by a licensed physician. There are manufacturers who will sell peptides online without a prescription, but this is both illegal and dangerous as the labs and pharmacies who create these products are unregulated. As Ipamorelin CJC 1295 is a non-controlled substance, it may be prescribed via telemedicine depending on state law, but a consultation and blood work should absolutely be included. If you would like to learn more about peptides and Ipamorelin with CJC 1295, please visit www.novagenix.org and give us a call at 561-277-8260 to schedule a consultation. We're located at 609 North Hepburn Avenue, Suite 106 in Jupiter, Florida, 33458 in the heart of Palm Beach County.